And now, Living Well with LDS Hospital.
And welcome back, everybody. Lupe Cruz joining us now from LDS Hospital. She's a certified nurse midwife, and this is one of those topics that you out there requested. We've not talked a lot about menopause on the show, and it is happening, of course, to so many women at so many different times. It's different for everyone. Let's define it first. What is menopause?
Menopause is a natural decline of your hormones and your reproductive hormones being able to reproduce. So it happens between the age of 40 and 50. Average age is 51. And it is the time when menopause actually happens, the time after you've gone 12 months without a period. And that's when you're in menopause. I think what you're talking about, what women are experiencing, is perimenopause.
How long does that period last?
So that can happen, that can be several years. So it can happen late 30s into your 40s.
That can even start in your late 30s.
It has to.
So these are pre-symptoms.
Right. Pre-symptoms,
okay,
right.
so let's talk about the symptoms of actual menopause. What are those?
So the symptoms can be hot flashes, night sweats, difficulty sleeping, vaginal dryness, anxiety, sometimes heart palpitations, and these things can be very disruptive.
What do you do when those start happening? What's the first thing that you should do?
So you could go into your provider and talk to them about your symptoms.
Your gynecologist, correct?
Right, right. And you know, midwives can do it too. You can go see your midwife or your OB-GYN.
But your primary care probably not the one. Or...
Well, your primary care may, if they specialize in that area, or if they have experience in that area, they can help you with that too.
Let me ask you this. Should you start taking hormones in perimenopause? Should you wait until menopause, or should you take them at all?
As your hormones start to fluctuate, you may need that hormone replacement. And that's when the hormones start to change, that's when you start getting these symptoms of the hot flashes, the vaginal dryness that's really uncomfortable. What it's recommended is with estrogen therapy, that helps with the heart issues that can come with menopause. And that's recommended that it'll help the best if it's within 5 years of your last menstrual period.
Is it safe to use a hormone, and can it cause cancer? I've heard that before.
Right, so that's an estrogen-dependent cancer. So what you'd want to do is go see your provider, and that they take a thorough history, they look at everything, and then at that point they determine is estrogen safe for you? Do you have to use something different? You can use the creams. There's vaginal estrogen that you can use. It's a little bit less risky. So that's something that you would want to discuss with your provider.
And there's a lot more out on the market than there was. I'm a nurse, and so in geriatrics, you saw the end result of that. But now I know that there's so much more on the market than there was 10 years ago.
Well, and talk about treatments. What is out there right now? What can people turn to?
Well, what you'd want to do, when you go to your provider, they can talk to you about the oral. That's usually the go-to is the oral or the vaginal estrogen. And depending on whether or not you've had a hysterectomy, a total hysterectomy, which is the hysterectomy and the having your ovaries removed as well, then you're going to need the estrogen. You're going to need different hormones if you still have your uterus. So that's what I mean when you go to your provider and they can look at everything, look at your history.
But Lupe, not everyone's the same, right? You talk to your mom, you talk to your friend, you talk to your sister. Everyone has different symptoms.
Yes.
Yeah, because the first question is, when did your mom go through? You know, to kind of see, oh, are you on the same track? But does that, is that
It can. I ask that question as well, because if mom
does
started
environment
early,
have anything to do with that?
It can. That can as well. And really only about 1% of women have it start going through menopause before the age of 40.
Okay, I have one more question, and this was out there on Facebook this morning. How do you maintain an active sex life while going through menopause?
So that can be a little bit difficult too because of the vaginal dryness and the decrease of libido. Using lubricants, using things that will help with that, and continuing to be sexually active. I know it kind of sounds like, well, how do you do it? And you know, but if that also helps promote, you know, that having that area be more lubricated so that you're not feeling like it's so dry.
If we didn't get to all, more.
You need to
Yeah.
keep you.
Yeah.
You need
Not
to use
less,
it.
not less is more, more is more.
Use it or
is
lose
what
it.
she's saying. And if you have more questions, if there's a question maybe we didn't answer, LDS Hospital has the answers for you. Their website and phone number on your screen. Go to our website and we will link you to all of their information. Lupe, thank you so much. I think we touched on an issue that, so many of us are dealing with out there.